All right, welcome back. A major study of studies is getting a lot of attention this week. The research shows there's little evidence marijuana can treat certain conditions. The Department of Veterans Affairs reviewed data from 27 trials where cannabis was used to treat chronic pain. Now, they found some evidence it could relieve pain from nerve damage, but couldn't make any firm conclusions on how marijuana affects other types of chronic pain. The researchers also found little evidence that cannabis actually helps PTSD patients, which is pretty interesting because that was a lot of the conversation initially. Joining us now to discuss, we welcome our medical contributor, Dr. Ali Kasraeian. Thank you so much for joining us.
Thank you for having me.
So let's jump right in and talk about how marijuana actually treats certain conditions.
It's very cool. You know, marijuana works on this concept of the entourage effect. So you can't go in and just kind of take the chemicals that work. There are about 500 different chemicals within the marijuana plant, the cannabis, and they all have to work together for it to work, whether it's medicinally or recreationally. And so for cannabis to work as a medicine, it has to have low THC, which is the factor that makes you high, and high CBD, which is cannabidiol. And so for something to be medicinally effective, and you know, Dr. Sanjay Gupta, in some series that he's done, this talks about this one 3-year-old child who had 300 seizures per week, and then was started on a medicine that had low THC and high concentration of CBD, and had 2 seizures per month. And so it made a big difference. And so it's the concentration. So you can't go in there and just take the CBD and give it as a pill. You have to have the plant grown in such a way that it has a low THC. And the way the CBD works is that it calms and keeps quiet the excessive electrical activity or chemical activity that's going out of order within the brain. And the way this stuff works is, so from a recreational standpoint, the reason people take smoke pot or ingest it or take it as an oil or inhale it is because it gets into your bloodstream, however you take it, makes its way to the brain, and it binds the receptors in the brain that then release dopamine. Everyone kind of hears about dopamine makes you feel good, so it kind of gets into the nerves, nerve cells all over your body, makes you feel great, and it makes you feel high. And so that's what we're chasing. So you got to make the THC low and make the CBD high. Unfortunately, it seems like the studies that are out there to study this are either small in number or badly done, don't have a control arm. So it's not like the 5 of us go out there and I, since I'm a physician, will be the control arm. You will be the control arm since you've never smoked pot. And then other people take medicinal, recreational, and you kind of follow down the line and see if it helps.
What are you assuming all the rest of us have smoked pot?
Well, we have to, well, we have to,
I'm just teasing.
Well, we have to have a study that's done correctly. So you'll have to, you guys will have to have control arms.
Let me ask you then, medical marijuana has been sold as a panacea for so many conditions. In your view, which types of patients can most benefit?
You know, that the problem with this is we don't quite know yet because this is so new, and we make such assumptions because people come on and say it can help this, it can help this, it can help that. The VA study showed that about 80% of people have been using this to ease pain. And the study that came out said that there are not any conclusive evidence that we can go and say definitively that it helped. And that is unfortunate for the people that really are hoping that this helped, except for the neuropathic study that you mentioned, the nerve pain, and even that study was not really that great.
Conclusive, right?
You know, so I think one thing that we have to do is actually do better studies. And more well-designed studies to actually see if it makes an impactful difference, so that we can have more conclusive evidence if it does help, or if it definitively doesn't help, so we don't go down this path, and then have better understanding of the medicinal aspects of things, so that we can kind of look at this entourage effect, and then if there are situations that it does help, we can have more impactful scientific ways to pursue it.
So if marijuana is being considered a medicine, is the FDA regulating this? And if not, should the FDA be regulating this?
I mean, right now it's a Schedule I drug because it can cause problems. You know, it can cause dependency, and it is, you know, one that's very, very problematic because we are seeing problems that have arisen from the fact that people are using it and having more access to this. You know, there's a study that just came out of France. 133% increase over the past 11 years or so in pediatric ER visits and admissions to the hospital. And these are children under 6 years of age. And you may ask, why, how is that possible? How are children getting access to this? And again, it's secondary access to this stuff. And we're seeing this in the United States as well, where as in a very short time in places in the United States, for now about, let's say in Colorado, in the 2 years or so around the time of legalization, they found that ingestion was a big source of more than 30% increase in ER visits. And these children are sicker, get more ICU visits from intoxication. And one thing that they found was edible access, because the packaging is so enticing and it looks like normal candy. And the other thing they found in the French study was, and it's a little bit different than the United States in totality, but the concentration of THC over the past, like 2004 to 2014, went from about 9% to 20%. So 20% THC can get you to get a loss of consciousness in about 30 minutes in a child.
Well, speaking of loss of consciousness, let's talk about Tiger Woods and his issue that he had with all of this.
Yeah. So Tiger Woods, among a lot of things, his DUI initial evaluation, his blood alcohol level was 0. But when the final analysis came in, he was on hydrocodone, hydromorphone, alprazolam, which is Xanax, and Ambien. So these are.
It's quite a cocktail.
Yeah, I was going to say that is quite a cocktail.
So Ambien is a medicine that helps you sleep. It's for insomnia. Alprazolam or Xanax is an anti-anxiety medication that's short-acting, so it's got a quick high. It's out of your system quick. Hydromorphone or Dilaudid is a pain medication that's 10 times stronger than morphine. So that's a very, very strong medication.
That's what they give in hospitals.
Right.
Not a home drug.
So you can, and then hydrocodone or Vicodin, Lortab, another shorter acting pain medication. And then on top of that, they had THC. So you mix all that stuff together, and if you put a kind of like a drug search, an interaction search, all these things can decrease you're basically going to decrease CNS depression. So basically your brain is going to become slower, your breathing can be affected. You can have a thing called psychomotor retardation, so your movements are going to be slower. So you can imagine when you looked at the video, all the things that they talk about. He's kind of dragging through the day, his speech is slurred, he's moving slower. All that stuff can be explained from the interaction of all these medications. And you don't need to be drinking to get a DUI. You're driving while intoxicated. And for him, fortunately for him and everyone around, he wasn't driving. He just happened to pass out where the car was there. Legally, it's unfortunate, but fortunately, he was in a situation where he didn't hurt himself or someone else.
You bet, yeah.
So you have to be very careful. Mixing these things is unfortunate, and it can be very dangerous. And as we learn more about THC, it's not quite as safe as we thought. So we need to learn and be careful. And if you are thinking about medicinal marijuana, make sure you're doing it under the guidance of a physician that is well versed in this. So you don't want to be taking these medications with a physician that is doing this for the first time, because this is not a safe venture to undertake with someone who's not really well versed in the pharmacology and the physiology of how this interacts, because it is a medicine, and it is one that may be beneficial in circumstances, but it could also hurt you just like any other medicine or anything that we put into our body.
Yeah, well, that's what I learned today, is there's just still so many unknowns.
There's so many unknowns that I don't even know why you would try it with so many unknowns, if that makes sense.
Right.
There are benefits and there are harms to everything that we put onto our body, whether it's natural or not, and so we want to be mindful of it. And it could interact with other things.
Sure.
Right.
If you're a chemo patient and this is giving you relief, that's one of the reasons why it passed.
Absolutely. I have a good friend of mine whose mom had pancreatic cancer, and this was the only thing that helped. But it was done under the guidance of physicians. It was done in a controlled setting, and it was done responsibly. So there are ways that things can be done in a controlled manner. So if you are having issues that need this, it's not something that you go and buy pot off a street, because it may not actually help, because the medicinal benefits of it are not going to be what's going to be in the medicine that you're taking, and actually the things that could potentially hurt you are going to be higher in concentration.
Consult with your doctor.
Absolutely.
There you go. Thank you, Dr. Ali.
Sure.
And this medical contribution was furnished by Kasraeian Urology, and you can hear more from Dr. Kasraeian on his weekend radio show, The Conversation. It's Saturdays on WOKV from 5 until 6 o'clock in the evening.